Hi, this is Dr. Felix Liao. Let's talk about impaired mouth syndrome and how this can impact your personal health as well as your professional career. Let's face it, dental practice is stressful. It takes a toll on your body. The more you are a cheap producer at a high volume practice, the harder your body has to work. So it's not surprising that after a few decades, for some of us, you got aches, pains, and fatigue, and scores of other symptoms. But they could be related to your mouth. And this is a surprise to many patients as well as dentists. So if you're tired of bending over your patient to earn your living, well, here's a way off your hamster wheel. And if you're fed up with insurance and staff challenges and high overheads, well, here's a path off that old method of practice. And if you get tired of and burned out of drilling and filling, well, here is the way to get super fulfilled and like you'll never want to stop practicing. I'm having so much fun. So if you have treatment plan not moving forward, well, it could be that the patient is looking for something else. And solving their impaired mouth syndrome could be the big game changer for many patients. Okay. So what I'm talking about here is a new GPS to evolve from teeth to mouth by paying attention to what I call impaired mouth syndrome. So a little bit about myself. This is about how to create your dream job as a dentist, evolving to become a what I call an airway mouth doctor, AMD. So I've been a general dentist for 40 years now. I got enough white hair to show for it, but therefore enough experience to compare notes. And I'm telling you, dentistry as an AMD has never been so much fun. I don't drill, I don't fill, I don't greet the patient with the shots, and I don't follow up that shot with the drill. I mean, how much fun is that in relating to a patient and in trying to create your income? I now focus 100% on impaired mouth syndrome and holistic mouth solutions. And I'm going to introduce that to you in some detail. I've written a few books about this because there's just no end to these cases. And all these cases are all just raising their hands. Hey, my story deserves to be told. So I'm going to share a few of them with you. But first, let's take care of number one, you. Knowing impaired mouth syndrome and treating it means you can work this way at a very low overhead, safe, away from aerosol. And of course, the patient loves it because my hand is not in their mouth, but outside. There's never any pain. There's never any fatigue. There's only positive side effects from doing this. So every one of these symptoms right here have been reported by my patients as a result of doing my appliance therapy to treat impaired mouth syndrome. So I define an impaired mouth as one that is able to eat, drink, and talk, and whine, and complain, and even smile, but it cannot support the head alignment with the jaws and the neck, and to cause pain, and cannot support airway to cause fatigue. And this, of course, will contribute to all of these problems below, okay? So what's a syndrome? A syndrome is a collection of symptoms connected to a condition, okay? So when you treat this issue right here, that I call 6-foot tiger, 3-foot cage, undersized jaws for oversized tongue, all of these symptoms will get better across the board. So here's an example of what we can do as dentists turn into impaired mouth syndromes experts. So there are many symptoms that will improve when impaired mouth is treated, as I say, and you are already licensed to treat impaired mouth. Anything that is connected to the mouth and the adjacent and associated structures, you are licensed to treat already, just that nobody ever showed you how. So that's why AMD provides the training. So here's a concrete example. This is a dentist who suffers from severe TMJ. She took up AMD training to fix herself. And we use a subjective units of distress on a scale of 0 to 10, 10 being that you are rolling on the floor in pain, or you're so tired you can't get out of bed, or your brain is so fogged that you can't work. So she had 9 symptoms for a maximal score of 90. She came in at 57. So in 4 weeks, went down to half, and in 10 weeks, it went down to 20% or 19%. This is pretty amazing. Now let's take a closer look. It's amazing that dental problems, medical problems, physical problems, mental problems, digestive problems, they all get better. A syndrome is a collection of symptoms that's connected to one condition. In this case, a structurally impaired mouth, which is treated by this appliance. So I know we dentists are super mechanically oriented. What's this appliance? It's not important. What is important is the diagnosis that you can treat yourself. Heal yourself from this whole bunch of symptoms. And once you're successful at that, you can treat your patients, because you have a whole new practice of patients waiting for you to rescue them. Okay, just that nobody ever knew how to connect these dots and provide the solution. Here's another case. This is a medical doctor who's an expert microsurgeon, and she had pain that could not be solved by a new set of cosmetically beautiful teeth. She even had jaw surgery, and she got a better looking profile, but she still have all kinds of symptoms. All right. So she had 11 presenting complaints. So maximal score on the subjective units of distress is 110. Her chronic migraine, she scored herself at a 10. Her teeth grinding, she scored herself as a 10, and jaw pain was a 10. He's a medical doctor, okay? So in 4 months' time, her chronic migraine went from 10 to a 1. Her anxiety went from 8 to a 5. Her teeth grinding from 10 to a 2. Her jaw pain went from 10 to a 2. Her brain fog went down to half, and her poor digestion even improved. Okay, so in 4 months, her total improvement was 70%. Again, this is across the medical, dental, and neuropsychiatric and mental, emotional spectrum. So this is why it's called a syndrome. So we need to start thinking beyond teeth and gums. We need to start thinking beyond this magic bullet for that. If there's ever a magic bullet, it's airway and sleep. All right. So what the body needs to thrive are these 5 things: alignment, breathing, circulation, digestion, energy, and sleep. Give the body what it needs, and health will thrive. And a holistic mouth is one that's structurally fit and sensibly used to provide all of these. Well, what happens when the mouth is not structurally fit? Well, then you'd have all kinds of problems. One of them is pain and fatigue. So that's why I wrote this new book called Relaunch Your Vitality, the missing key to getting free from chronic pain and fatigue. Every adult patient needs this. If you grow up in America, you work in America, you live in America, you need this. So here's an example of a bicuspid extraction case. They always suffer more severe and more extensive impaired mouth syndrome than non-extraction cases. Look at her presenting complaints in blue. Neck pain, headache, teeth grinding, wakes up in the middle of the night 3 or 4 times, hard to go back to sleep, pain, hand, feet. She had 4 teeth pulled for braces in her teens, and braces again at age 32. What didn't connect? She wake up refreshed only once a week. You cannot stay even. You lose ground, age fast this way. Look at the midline, way off. What happened to the orthodontics? Something was missed. Long story short, she came in one day and said, no more migraine the past 8 weeks. And we both did a jig. What joy, okay? This is what we mean. Total happiness. No pain, no shots, no drugs, only positive side effects. Here's one from Australia. She reached out from the other end of the world to contact me after reading 6 Foot Tiger, 3 Foot Cage. She had cosmetic dentistry done. Parents spent money to give her braces. Unfortunately, she had bicuspid extractions, and the face tells the entire story. She reached out because she nearly killed herself because of pain a number of times. And we need a different bar than straight white teeth. Look at this airway here, okay? Her airway is 20% of what she needs to be comfortable. And her bicuspid extraction caused her condyles to be retreated, so she is in perpetual pain every time she brings her teeth together to swallow. Long story short, here's what treating impaired mouth syndrome can do. Jaw pain started out at 10, went down to 0 in 28 weeks. It didn't take all 28 weeks because it went down to half in 4 weeks, okay? Sleep disturbance, improved. Snoring, improved. Neck pain, 8 to 3. Poor digestion went from 10 to 3. She had a total gain of 67%. We pulled her from the brink of suicide because of the jaw pain, because of the sleep disruption, because of the neck pain, and because of her sense of hopelessness. All right. So the mouth matters a great deal. And it's time for us to see past this set of beautiful white teeth and see that this patient cannot breathe, even if she eats right, and she's miserable, okay? So the mouth place, according to Dr. Paul Chek, she wrote an article called The Totem Pole Hierarchy of Survival Reflexes. And the most important ones are breathing and eating. That means we're on top of the healthcare totem pole. His view and my view are completely consistent. Health and survival and wellness all starts right here. So here's just some of the typical signs that we go over when we look at the impaired mouth syndrome, when we evaluate the patients. You all know about teeth grinding clues. You know about bicuspid extraction already. You know about tongue tie already. Most of you, obviously, we see midlines off all day, but we do nothing about it because we do not have impaired mouth syndrome on our radar. This is really important for the next generation to not repeat the same thing. Some of you may have children yourself. How do you raise children so that they don't grow up with impaired mouth syndrome? so they don't end up with bunched up teeth that require bicuspid extraction to deliver a straight white teeth to the juniors. So in closing, I want to just share you with another case that happened early on in my career, and it's always stayed with me. She came in after she ground through her night guard, 4 years after her braces came off, and the orthodontist gave her this night guard. How do you think that treatment worked out for her? Look at her face. What does this speak to you? Well, I told her there may be a root cause solution. And they said, there he is. I would love to get to the bottom of teeth grinding. So the mother and the young lady both said, yes, let's treat the root cause. So here's the treatment. You can see the anterior open bite at the start. Now, about 2 years later, it closed nearly completely. No braces to date, okay? She was a happy camper after that. And we don't have time to go over our video here, but she's available on Vimeo, on my Holistic Mouth Solutions channel. But this picture tells it all. Same person. You can dye the hair, but you cannot change the profile unless you know impaired mouth syndrome and epigenetic oral appliances. Okay, so she stopped her teeth grinding. She became more radiant because we tripled her airway. She went from 7.7 cc to 24 cc. This is roughly around 2.5 years. And when you treat impaired mouth syndrome, you can produce results like this. That's why I love my job, because all the women come back looking more beautiful, radiant, and make this world a better place. So I love it. And I know that everyone who's taken up this training has enjoyed it. And you have a whole new practice full of patients who need these cases to be treated by not a dentist who focus on teeth and gums, but a dentist who focus on impaired mouth syndrome. There's lots of revenues left untapped in your practice. Just think about teeth grinding cases, crowded lower anterior cases, TMJ cases, bicuspid extraction cases, and all the persistent dental sensitivities, all the teeth that have gum recessions, abfractions, and failed implants. Never mind your dental patients with medical conditions like chronic pain and fatigue, depression, anxiety, obesity, and all of that. You got a whole new practice waiting for you out of your dental patients. If you just mention impaired mouth syndrome and get trained as an AMD, you will totally enjoy your practice and never miss the drill and fail. So start looking for a junior associate to take over your drill and fail practice and enjoy being an impaired mouth doctor like I have. So here's how to reach me. And if you want to register for AMD training, here's the 800 number. I hope to see you soon. Take care. Bye.